I'm sorry. 6. Big, big, big influence. Big, big influence. If you don't believe me, open up any men's magazine or open up any women's magazine and you will see similar models. Yeah. Is there any point in taking this picture? Aunt Sally, is that her? Is that Aunt Fatima? To me, it makes no sense to take this picture. But to him,
it's to cover their beards.
It's common sense. To him, it's a common sense. To us, it's like, what is he taking a picture of? This is an example of what is called a confirmation bias. What is a confirmation bias? Somebody want to take a stab at it?
You already have an opinion and everything you see confirms it.
Excellent. So we have a native belief. Any piece of data that comes in that confirms your native belief, you take a notice of it. And that's what they're doing. They both have native belief. They both are a piece of data for each other that confirms their native belief. Exactly then the same conclusion. I think Republicans are evil, and they are.
Common sense.
So, every time I see an evil Republican, I go, see, I knew it. Right? I see a saintly Democrat, see, I knew it. Yes? How many of you think that the Asians are very good in math? No, nobody here? Okay, well, you get the idea. Yeah. Why is she bothering to look at it? It's exactly the same one. And look at that. They have a large one, medium one, extra large, medium. It's yeah. To her, it's a common sense. They're all the same. Now somebody's going to have to talk to Donna. The cognitive trap. So we looked at the cognitive traps. When we are in the cognitive trap, will you know it? You will not know it. You will not know it. Frontal lobe fails to detect the BS. We will not perceive that we are in a cognitive trap. And therefore, we cannot accept it, and we attribute this to the common sense. 99% of all germs are killed. Wow, that has to be good. Kills 9. I have a Curol thing on my desk. Every time I go touch a patient, I do this. Kills 99%. It has to be good, right? Well, let's look. So if we had 100, and how many would survive? 100 germs. It kills 99 of them. Obviously, 1 will survive. If you had 1,000, 10 would survive. So let's just keep following. So if you had 10 million, 100,000 would survive, and 1 million would survive. Human skin then has so after killing, you have now all the microbiology students out there in the land, I know this only happens in a petri dish, in a 35 degrees centigrade incubator, but just work with me, all right? Yeah, this doesn't happen on your hand, not at this rate. These are the numbers that they would use in the perfect environment, okay? So it's not exactly the same. What you see though, you started with so many, yeah. So if you're not losing weight, you're drinking the wrong water. This, my friend, is a diet water. Yeah, because I know people are buying out there. Let's not show any hands, okay? I don't want to embarrass. How many people have heard of shampoo that has vitamin E in it? Well, I have it in my bathroom. Yeah. How about what else do they have? Micronutrients in the shampoo. Yeah. What are vitamins? Okay. Yeah, I know. I will tell you. They're coenzymes. Coenzymes and enzymes, as you all know from your chemistry class, I'm sure, take part. They do not take part in the reaction, but they make reaction happen. What kind of reactions are happening in your hair? Oh no, the hair is dead. Hair is dead. Does it need nutrient? Does it need vitamin? Papaya extract. It smells good. But who in my hair is going to use papaya?
Gotta feed the lice somehow. Yeah.
Hair is dead. So look, we had this discussion, right, honey? Friend told that if you cut the hair, your hair will grow faster. Anybody heard that?
I've heard that.
Yeah. Hair is dead. When you do something to the one end, the other end doesn't know. The other end doesn't know. So if you cut it here, you know she cut the other end. You better go fast. No, that does not happen. That does not happen.
That's
Okay?
the excuse they use to tell girls not to shave their legs, because if they start shaving, the hair start coming out.
Yeah, that is BS. What does happen, I'll tell you what does happen. If you shave it, you get a sharp edge, and that what pokes you, not the roughness of the hair. The roughness of the hair, the shaft of the hair, doesn't care. It is the edge that when it's cut, it's sharp. Yeah. So where was I here? Why is that toilet paper over there? I get it that somebody put it there by mistake, but do you have to put a roll? Confirmation bias, we just talked about it, right? Recall bias. Who has experienced this? You are thinking of your ex-boyfriend 20 years later, and one day he calls. Boy, isn't that something? I was just thinking about you. The Lord works in a mysterious way, does he not? Energy, no? The planets are lined up, no? Well, you have to admit, he is your soulmate. 20 years later, you were thinking of him and he called you. It's your destiny. It's your destiny.
What are the odds?
Lord, that's the recall bias. The thing is, if I'm thinking of my ex-girlfriend, and I'm not. If I think of her 10 times, she doesn't call, do I remember? No, those are non-event. If I happen to think of her one time and she calls, often called coincidence, it's an event. Event you remember, non-event you can't. Recall bias. Well, that will happen once you're dead. You'll remain dead. The fundamental attribution error. The fundamental attribution error. This is a classic example of a fundamental attribution error, okay?
Say again, what is it?
It's called fundamental attribution error, and I will explain what that means. When you are at the pediatrician's office, You see this baby, smells bad, diaper is ripe, dry snot around the nose, hair is not camped well, baby's running around disturbing everybody, right? Yelling and screaming. Here's a suburban mother, very wonderful hair, diaper bag and 3 other luggage and this perfect stroller and very nicely behaved. What does she think of that little baby and her mother?
Bad mother.
Bad mother, poor parenting. Yes? A little later, her baby gets up, it's the same age, runs around, does the same thing. She's hungry. She's hungry. And when she wakes up from the nap, sometimes she's cranky. But a very good kid. So, other people's situation you attribute to their personal trait. Your thing is situational. It's not a personal trait. I cut somebody off because I'm late. I am needed for important surgery. Or I'm needed for that important Facebook update. Somebody else cuts you off. He's an asshole. Personal trait. Me? Situational. My wife? It was about her life. You are a godless baby killer. I hope you're happy. Fundamental attribution. Your choices are your personal trait. My choices are situational. My wife's life was in danger. You were raped. That's a gift from God. Recent one, right? I didn't make it up. Yeah. Well, it's authority bias. It says so right there. I can't stand there because I don't have time. I have to go in there. Well, this reminds me of another joke. It's an Indian joke. There is a line like this. It says, obedient husband, independent husband. All the obedient husbands are here. The independent husband is there. The reporter is asking him, why are you here? He says, I don't know, my wife told me to. So let's look at this. Will you donate organs? So Sweden, 85%, Portugal, 99%, Poland, 99%, 99% in Hungary, 99% in France, 98% in Belgium, 99%. Those Nazis. 12. 17.17. Netherlands, Denmark. Are these not similar cultures?
I wouldn't say so now.
What happened here?
They all killed themselves.
Instead of phrasing something's
Say it, yeah.
Something's rotten in Denmark.
Something's rotten in there. For a moment I thought he had the right answer. Yeah. So how do you explain it? And I will tell you. These people and these people, the only difference was, he said, check here if you want to donate. He says, check here if you don't want to donate. What is more significant and consequential decision than to donating your organ? You give them a choice not to think they will donate. It's a commission versus omission. You're going to commit, it scares you. So I use that information and say, you don't want to donate? Commit. Ooh, I have to check a box. If I don't check the box, I don't have to. I don't have to. 99. Switch the question over. Switch the question over. What is more commonsensical than that? Do you want to give your heart or not? It's a very, very profound decision. We don't want to think. You don't want to think. Yeah. Okay? You don't want to think. Our brain responds more positively, more strongly to negative emotion than true or false.
I think that's true.
Common sense, right? Except that peace now versus stop war. The stop war is recognized and works better. Depressed people have a poor judgment and will pay less attention to detail.
False.
You're depressed? No common sense. Well, I know what it is. It was true and the false. So if I say false, I'll be right. So I'll be right to be wrong because I was wrong when I was right. It's the George Costanza logic. It's the opposite day. Yeah, it's the opposite day. So, yeah. So what is it?
So false.
True.
True, false. Yeah. It's false.
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 Yeah. Is it opposite of common sense?
Yeah.
It only works if you are in a therapy that you are helping. How about this?
Oh, no.
33%.
33? No, that's not even a choice.
Chances you're gonna be 50% correct.
Yeah.
But then you're 25% chance.
No,
No.
there's 225s.
Yeah. You see, it's a double reverse pseudo-negative. You don't know what it means.
Oh.
Yeah, double reverse pseudo-negative. You don't know what that means. Okay. Never change your answer on a multiple choice question. Now you're not so sure, are you? Did anybody ever see that commercial where there's a very mean teacher, you know, and there's this little kid with this huge glasses and he's sitting in there and he's taking a makeup exam and she's got the yardstick and going, 1, and the kid says, true, false, 2, false, no, true. So he does it like 4 times. And by the time the 5th question comes, the kid is like so scared. She goes, true walls? True. That's how you feel, right? True walls? I don't know. Yeah, it's true walls. The first instinct fallacy, new research shows that you're 2 to 3 more likely to change wrong to the right answer. It doesn't happen to me though, by the way. You know, every time I change it, I lose a point. Yeah. Swine flu is more dangerous than regular flu. Oh, you are all free thinker, of course. Yeah. NMR, that's a different lecture altogether. Yeah. The gentleman lost his license, paid $800,000 he gave up the $800,000 he received, lost his license, and article was retracted. But don't tell that to Jenny McCarthy. Analyzing handwriting can assess personality. Well, they teach classes at the Johnson County Community College. No data supporting this. That is a fabulous signature. All right, that's all I'm saying. True?
Yeah.
Well, I mean,
I
both
think
sexes.
everybody communicates
Yeah,
differently.
everybody does.
True walls?
Yeah, I would say it's false.
That's very wrong.
So it depends if you fall here or here. Yeah. So we all use around 16,000 words. There's no dirty words up there, guys. You read it, I didn't.
I'm slapping
You
the joke
applied
of
it.
We'll see. I suppose it's a bad word. Did the frontal lobe deceive you there for a second? No, you're too smart? Nobody's frontal lobe deceived them. I heard some chuckling. Josh is the only honest one. Thank you, Josh.
Well, now we're on the word form.
Now you don't know.
I'd say false.
I'd say true, just given that they've shown that disposition can affect your immune system.
So you're saying true. Sir?
I'll
I'd say true.
define positive thinking.
Cancer.
Sometimes.
That's all I have.
Are you positive I'm gonna die?
That's all I have. Yeah, I'm not giving anyone a explanation.
I'd say it's false in terms of the statistics, but it might be true in terms of the experience.
So what is it?
True all.
False.
40 to 65% of the survivors believe that their cancer was caused by stress. A 94% survivor believe that they became cancer-free because of their positive attitude. Why is that statistic? Why is that statistic suspicious?
Say only yes or what?
Exactly. The dead person doesn't say, you know, I had a crappy attitude and I died. He had a crappy attitude, he died. He ain't there to tell you about it. It's data, statistics, right? How can you argue with data? Well, you can't. It is true. What it says is absolutely true. But who is taking the survey? The survivors are taking the survey. Susan Sontag, a prominent cultural critic, developed cancer. She later wrote in her book, she was horrified that the old psychoanalytical belief that cancer is a disease of emotionally repressed people. That's blaming the victim. You were raped. You were dressed like a slut. Blaming the victim. You got cancer? You were emotionally repressed. Blaming the victim. At one point, he was also taught a certain personality type and TB until Mycobacterium tuberculosis was positively identified as being the organism that causes the disease. Has nothing to do with your personality. We now know it is the gene, BRCA1, BRCA2, breast cancer gene 1, breast cancer gene 2. If your mother and your sister had it, you are more likely to have it. If your father and a brother both had a colon cancer, you are more likely to have it. Not because of your personality, but because of your genetic makeup. War on anything, insert a noun here. What is the first casualty of war? Sir, you know the answer? First casualty of war is?
The truth.
There you go.
Truth.
Truth. First casualty of war is truth. When you have a war on drugs, you do not want to tell people that. We have war on what?
Christmas.
War on Christmas.
We're
We
on
have war on cancer. We have war on drugs. We have war on terrorism. Yeah, everything is fair in.
Love and war.
Yeah, there you go. The discovery that emotion can influence cancer risk recovery. We all have a potential of our own hearts and minds, she wrote. type C connection. Bernie Siegel, MD, and surgeon at Yale University. I simply began to question why some people didn't die when they were supposed to. What's wrong with that sentence?
Because it's still alive.
Who the hell is going to decide who was supposed to die? My pathology professor said this, that he was a young professor of pathology right off, and the neighbor had a lung cancer. The neighbor's wife found out that the neighbor is, pathology. She brought all the x-rays, showed it to him. He looked at it. I gave him 7, 8 years. 10 years later, the man would mow his lawn at 5:30 in the morning to get back at Dr. Bellows. And Dr. Bellows said, I will never tell anyone how long they have to live. Nobody knows. Nobody knows. You can't look at somebody's x-ray and say 1998, December 7, he dies. No, we don't have that kind of technology. Okay? We don't. In 2012, we don't. How did he have it in 1960? I do not know. He asked the patient, why didn't you die?
Okay.
Well, what the hell is the patient going to tell you? Yeah, so he says, well, I moved to Colorado, and the mountains were so beautiful that I forgot to die. Sells excellent quote from the book. Look, then you shall find. He found that there were differences in personality of those who survived versus those who did not. Survivors were more open-hearted, feisty, in touch with their needs. And those who did not were emotionally depressed. What's wrong with that assessment? You don't have to be a doctor.
Could he ask about the people who didn't survive?
No. The people before they died, this is what he found. They were more emotional. Go ahead, sir.
They were dying.
Exactly. If you are dying, are you going to be feisty? Open-hearted? I don't have any energy. I can barely breathe. Of course I'm repressed. I'm going to die tomorrow. These people were doing well because they weren't dying. It's not the cause and the effect. It's the association. It is the association. Dying people are more emotionally depressed. Not dying people are feisty. They have more energy. They can take the bus to their chemo. Because they're not that sick. The guy who's going to die is not going to take the bus. He's not that feisty. He has given up. He doesn't have enough energy. Must be on to something. In 1978, Dr. Siegel set up an exceptional cancer patient program. He called it ECAP. The program was designed to make patients who were not exceptional into exceptional. So if you were dying, I was going to beat you till you became feisty and take the bus to your chemo. ECAP. Program included dream analysis, art therapy, and talk therapy. He called it care-frontation. Okay? Trained counselors would ask, what benefit are you getting from your cancer? Can you imagine? Can you imagine that you've been diagnosed with cancer and some uppity 23-year-old girl comes and tells you, what benefit are you getting from your cancer? Blaming the victim. Blaming the victim. What would it require for it to give it up? Blaming the victim. Love, medicine, miracle. Dr. Siegel wrote a book with that title. Sold 2 million copies. It is my main job as a doctor to help you develop into the new person. You can resist the unwanted, uncontrolled development of the illness. The book sold more than 2 million copies. The critics say that the friends and family bought the book and gave it to the patient. It is a test when the patient asks, While me, Lord, Dr. Siegel writes, the exceptional patient says, try me, Lord.
Yeah, okay. You get it in the video.
I'd like to introduce myself. I'm Bernie Siegel, a surgeon. And I'm here to tell you that if you've made a commitment to do what is outlined in these tapes, you're an exceptional patient. I've learned that it takes work to be exceptional, to exceed expectations. I learned that the people who came the furthest to see me did the best because they made a commitment. It was really the words of one of our patients. She got over an ovarian cancer when she wasn't supposed to, went home to her own community, and everybody said, how did you do it? She said, look, here are the tapes, here are articles, go home and do it. And that's the message, to do it. I get a lot of credit for people who get well. I really haven't done it. I can be a facilitator. I can help redirect you, but I can't do it for you. It's no different than baking a cake. We can give you the recipe, but you have to put the ingredients in. You have to do the work. And it is work. If you do it, it won't feel like work because part of it is loving, part of it is laughing. There are a lot of things that go into it to help make your life a better life and live messages to your body. But it starts out as work because change is scary. W.H. Auden, the English poet, said, we would rather be ruined than changed. We would rather die in our dread than climb the cross of the moment and let our illusions die. We're showing you that change is important. We're showing you how to do it. Don't be afraid of it.
What is the message? Buy my tapes. Buy my tapes. What else is he saying?
Blame the victim. Choose not to do it, it's your fault.
Yeah. If you have a sufficient faith, the holy water will cure you. And if it didn't, you did not have a sufficient faith. That's what he's telling you. The oldest can be the oldest can. But how does he present it to you? Does he present it to you as an easy solution? No, he presented to you as a hard solution. But in the end, what does it say? Well, it won't feel like work because he knows that if it's a hard work, American cancer patient ain't buying it. Okay, it's not going to be work. So it's a hard work, but it's not that hard. You can do it. You can do it. Just buy my tape. That's all it takes, right? Watch this now. This is the same gentleman 25 years later.
There's nothing wrong. See, this is another argument we get into our television program with giving people hope. And they would say, you're giving false hope. You can't give false hope. You know, I can hope I'm going to win the lottery, all right? Now, if I'm an idiot and go out and spend, you know, hundreds of thousands of dollars knowing I'm going to win the lottery, that's different. I mean, that's stupid.
I'll stop it at that. What does his body language tell you compared to the first one? He doesn't even look like the same one, does he?
No,
More mea culpa, more gentle.
he's been taken down a peg or two.
Yeah. What is he selling now?
A different scheme.
The problem was he's a surgeon, not an oncologist. What is the difference? Surgeon cuts the tumor out. It is the oncology who treats the cancer. What you see with your eye is the tumor, but what you don't see is the cancer. So when he says that these ovarian cancer people were supposed to die, he doesn't know what he's saying. Who will make the determination whether the cancer patient dies or lives? Pathologist. Pathologist. They can look at the individual cancer cells and determine what stage the cancer is in, what grade the cancer is in. That's how you determine the prognosis. And even then, is it accurate? It isn't. He's a surgeon, he's out of his elements. He's out of his elements. His job is to cut. Me, surgeon, I cut. He's out of his element. This is not his job. The proof is in the pudding, or at least it is in the randomized clinical trial. In 1974, he puts it up. In the randomized trial in 1993, the 10-year follow-up showed that through the honest reckoning of repressed tissue, life made no difference in survival. The quality of life had improved, but the longevity was the same. Was he selling the quality of life or the longevity in those tapes?
Longevity.
I ask you to decide. Okay? I ask you to decide. Women with the breast cancer who went through Dr. Siegel's program turned out to have died at the same rate after 10 years, a follow-up group of a matched control. Journal of Oncology, 1993. Dr. Bernie Siegel subsequently resigned. He's not allowed to teach. He's now energy healer because the medical license isn't there, so you have to use the energy. Yeah. Okay, let's about something lighter now. Something lighter. Let's look at this. You are about to. Well, you can read it. I don't have to read it. Will you drive 10 minutes to save $7? Okay, not everybody at once.
Depends who it's for.
Sorry?
If it's a gift, maybe not.
If it's a gift, maybe not. You're giving it away anyway. You don't want to save $7. No.
How much is that gonna cost me in gas?
It's 10 minutes away.
I've got it.
I would drive.
You will drive?
I would drive to get the 21 miles.
I drive now, but there were times in my life I was working single parent.
Yeah, so the 10 minutes
The
would
10
not work.
minutes might have been worth more than the $7.
Sir?
Same, just depends on the situation.
Yeah. All right. Let's look at this situation.